Hello, everyone. I'm very happy that you are all here, all of you, this afternoon. We're here to talk about the ongoing cocaine flood in Europe and what we can do against it. And my name is Judith Eisinger. I'll guide you through the event tonight. I'm a board member at Mafianeindanke, which is the only NGO in Germany that is dedicated to the fight against specifically Italian organized crime groups and to form a civil society anti-mafia movement. The Mafianeindanke organization was created in 2007 after the so-called Duisburg mafia murders, which is when 6 people of the Calabrian 'Ndrangheta were shot dead in front of a restaurant in Duisburg by members of a rival 'Ndrangheta clan. And so since 2007, since the organization was created, Mafianeindanke is raising awareness of the dangers posed by Italian mafia groups in Germany. We advocate for improvements and the harmonization of laws, both on the national level and on the European level. And in short, we stand up for an open democratic society with fair opportunities for all. And if you want to support us, you're very welcome to become a member of the association or donate. You can find everything on our website. But today we're here to talk about cocaine. The cocaine flood means that more and more cocaine of higher purity is available in the legal market, and there seems to be no way of stopping this cocaine flood. So of course we need to keep in mind that cocaine is not the only substance in the current drug market. Actually, it's very versatile with many different substances. But we chose to focus on cocaine today because it has dominated headlines in Germany again and again, when massive amounts were seized or found, for example, in the harbor of Hamburg or Wilhelmshaven, and also when analysis of wastewater showed that the consumption in different German cities seems to increase. So today we have several speakers with us who will help us discuss and dissect this topic. We have Daniel Brombacher from the Global Initiative Against Transnational Organized Crime, and he will talk about the global cocaine market for us. And then Dr. John Collins, also from GI-TOC, he will speak about evidence-based drug policies. And here, unfortunately, I have to say that John Collins is unable to join us live today because there was like a last-minute move in his medical appointments. But he kindly recorded his presentation, so we can still watch it. And Daniel, who is also very knowledgeable on drug policy, might be able to answer your questions on this topic, so we will still be able to cover it properly. And as our last speaker, we have Joella Anupol from EUDA with us, the European Union Drugs Agency. She'll talk about drug-related crime prevention and social responses. After their presentations, we will have time for a Q&A, so you can ask your questions however you want. We have the option that you can type them into the chat. You can also upvote questions that you find interesting, but you can also raise your hand and ask the questions in person. And also, our speakers are not able to see or hear any one of you. So in case you want to show that you're here and listening, feel free to use the emoji reactions that you can find on screen. So now, without further ado, let's give the floor to Daniel. He is the director of the Europe Observatory for the Global Initiative Against Transnational Organized Crime. And before that, he headed the Global Partnership on Drug Policies and Development at the Deutsche Gesellschaft für internationale Zusammenarbeit. Daniel, the floor is yours, and I'll share your presentation.
Thanks so much, Judith, and thanks again for the invitation to the great team of Mafianeindanke. Good afternoon, everyone, or good evening from Berlin, where it's quite sunny, so I appreciate that a lot of people are actually joining despite the beautiful weather. The presentation is called The Global Cocaine Market, but I will focus mostly on the regions of origin and of Europe. But still, I think with the 20 minutes I was granted, nothing else is possible, but I'm happy also to speak about, let's say, other world regions with regards to cocaine later. Next, please. Next. Apologies if I may tell you things that you already know. I just started with the basic facts because I think we have quite a mix of participants here in this webinar. So key fact is all cocaine in the world originates in less than 5 countries in Latin America. Actually, it's mostly 3 countries. So it's Colombia, Peru, and Bolivia. There's a bit of cultivation also in Central America and in Mexico, but the major share of it in Colombia, as I think most of you know, is the biggest producer of coca leaf, the raw material for cocaine. Why is it that it's so concentrated, the cocaine economy and the coca cultivation? There's a mix of different factors. Judith just mentioned my previous job at GIZ, where we worked on these issues. So what you would find in all these countries, and that actually also applies for the other countries you see on the map here, the coca cultivating and main cannabis producing countries in the world, you have a mix of weak territorial control and porous borders, unstable security situation, poverty as a key driver, and a lack of access to illicit markets for alternative licit products. And in several of the countries, you have a massive presence of criminal or insurgent groups. I think Colombia, the best known example, and also Afghanistan for opium poppy. But then you would also have in these 3 South American countries I just mentioned, certain set of cultural traditions and expertise in order how to grow it. Other than expected, climate and geographic conditions are of secondary relevance. So in principle, you could grow coca leaf in dozens of other countries. Actually, in colonial times, Indonesia was a country where coca was grown under the Dutch colonial rule, but you would only find it in this very limited set of countries because a lot of factors need to come together that you actually have this cocaine economy growing. I mentioned that traditional cultivation is very strong in Peru and Bolivia. For those of you who have been there, you know that coca leaf and coca chewing is quite widespread. Especially, but not only within the indigenous population in these countries, but that also applies to some regions of Colombia, even though in Colombia that share of the traditional cultivation and use of coca is way smaller. Next, please. For those of you who have followed the news, there's we currently see. We speak a lot about a cocaine wave, also in the title of the event here today. We have a cocaine wave in Europe, and that, of course, is linked to a cocaine supply wave that we see in Latin America, particularly in Colombia. This has basically started in 2016 with the peace accords with the FARC guerrilla in Colombia, and afterwards there was this steep increase for many different reasons. I won't go into the details now, but happy to pick up on the discussion of coca cultivation and by that of cocaine production. That is, again, following numbers from the United Nations Office on Drugs and Crime, UNODC, has again hit a record high in the last year of monitoring, that is in 2024. Next, please. What does it mean? Does it mean like everyone's getting rich in Colombia, Peru, and Bolivia? No, it's not the case. This graph shows how the cocaine supply chain works and where most of the money is being made. We just picked randomly here an example of how much a kilo of cocaine on retail markets in Belgium would be worth. And as you can see, coca farmers in South America only get a very small share of this whole market. The same also organized crime groups, drug trafficking groups who are closer to the cultivation centers that are trafficking cocaine within South America also have quite a minor share. And then the higher the risk of the traffickers, and the risk increases the closer you get to the consumer markets. That also applies, of course, to other consumer markets, not only Europe. The higher the share, then the more the money you can make with that market. You may ask, and I get to that later, we are currently seeing a decay in wholesale prices in Europe. So cocaine at wholesale level has never been so cheap, but retail level prices have been quite stable. So this is a retail price that you see here. Next, please. Next, please. What does it all mean for Europe? We have also a UDA speaker on the panel following after me, and also other UDA participants here in the room. They published this great and very informative data on wastewater analysis. So you can measure cocaine metabolites in wastewater in this case in European cities. And here you can see that we a key driver, of course, of the cocaine wave that we have seen in the last years in Europe is not only the supply. Of course, it's always an interplay between supply and demand. And you can see, especially in Western Europe, those cities that participate in this wastewater monitoring, you can see there is a strong increase in the last years of cocaine use all over Europe, especially again in Western Europe and less in Eastern European cities. You even have that divide in Germany, with the exception of Berlin. So you have way higher cocaine use in Western Germany than in Eastern Germany. Again, Berlin is the exception, but that's quite an interesting phenomenon. Next, please. Again, taken from UDA, a key driver of cocaine, of the cocaine market in Europe in the last years has been what a lot of people call a crack epidemic. You see, again, especially in Western Europe, again, especially in Western Germany, you see a massive increase in crack use. Those of you living in Berlin, you can see that in daily life quite a lot. It's quite a visible drug market, and it's quite sort of intrusive phenomenon in many German cities, and it has come across with a lot of major challenges for European cities in order how to deal with it. And this is trends in first-time treatment. Entrance in hospitals in Europe, and this is basically a consistent picture across Western Europe. Next, please. Again, another indicator you can take if you want to measure what's happening on the European cocaine market is, of course, cocaine seizures. Judith mentioned it in her introduction. In Hamburg in the last years, until recently, in Antwerp, Rotterdam, etc., we have seen a massive increase of cocaine seizures in the last year. That does not necessarily mean that more cocaine is coming in, but it could mean that more cocaine is coming in. It's also, of course, reflecting law enforcement priorities. But until 2023, we saw this massive increase in the past decade. But now it's going down, and I will get to that later, what that may mean and what it doesn't mean. If it means that less cocaine is coming in, or if it means that we are being outsmarted by organized crime, that's one of the next points. So next, please. At the same time, with this decrease of seizures, we see also that we have a decrease of wholesale prices. I already mentioned this is quite marked in some Western European countries. This is data from our European Drug Trends Monitor, in which we research organized crime and drug trafficking trends across Europe. And as you can see in the last years, you see this constant decay of wholesale prices for cocaine in this case in the Netherlands and Belgium. In some countries, it's even more nuanced. We just heard from Spain that in Spain, you can now get a kilo of cocaine for 10,000 euros. Until a few years back, it was 30,000 euros. So this clearly signals that we have a situation that we do see less cocaine in Europe, but that actually more cocaine is coming in than ever before. We have an abundance of cocaine that we have never had before in Europe, and apparently the great ports are being avoided now by organized crime. We see other entry points. I will get to that later, and that's quite an alarming trend that we see, because yes, we have made our ports safer in the last years, but we have not managed to really stop or even reduce the cocaine wave or the cocaine flood to Europe. Next, please. Again, this also from our European Drug Trends Monitor. This map shows how much is cocaine at retail level, and you see a trend that are already that you also see in the wastewater analysis data, but expressed through prices. You can see where cocaine is cheapest at retail level in Europe, and with the exception here of Switzerland, you can clearly see there's a west-east trend. So the closer to the wholesale supply, the closer to the countries of origin in Western Europe, the cheaper the cocaine gets, and the farther you go east, and Germany is in the middle, the more expensive it gets. Next, please. What's happening? Why do we seize less cocaine? But why is cocaine so cheap? When you look across Europe, you can see it's the typical cat and mouse game that you see between organized crime and authorities. You see here in the red arrows on the map, it's also a GI map. You can see like traditional entry points for cocaine, and the blue arrows show where else in the last years we have seen increased cocaine seizures. So we see that's on ports. You can see that organized crime is avoiding these ports where a lot of efforts have been put into making access more difficult for organized crime. This particularly applies to Rotterdam, Antwerp, and Hamburg, which were leading the statistics in the last year. And you see like a move towards secondary ports, smaller ports, less controlled ports. And a lot of these ports are often not necessarily the closest one or that are easiest to reach. So logistical concerns are really secondary in relevance. So for example, cocaine seizures on the Baltic Sea, that's something quite new we had not seen before. Cocaine seizures in Scandinavia and also in Southeastern Europe on the Western Balkans. This is some of this what is usually called a waterbed effect that we see on cocaine. So stronger controls are being avoided to avoid risk, and then other entry points are being identified. Next, please. We get this question quite often, and I think the same happens to UDA colleague. The question is very often, how big is actually the European cocaine market? But this is very, very difficult to make an estimate, because we have most of the potential entry points to get to such an estimate you just saw. You can take the prevalence data that is based on surveys. You can take the wastewater analysis that is available only for a selected amount of cities, but not for all over Europe. And then you have the seizure data. And of course, you can also take the pricing data to get like a rough idea how big that market is and how supply and demand work together. But what you would also see then that these numbers don't really add up. So when you have prevalence data for a city and then you have wastewater analysis, even in that case, you get to a very different size of the market. And we also see that estimates vary widely. Europol estimated that's not too long ago that the European cocaine market would be around worth 10 billion euros. There was an estimate, but at the same time, I think the year before, for example, the UK published an estimate for the UK cocaine market, and it had the same size. They came to the same conclusion, roughly 10 billion euros transferred from pounds. So you can see there's a massive difference. Yes, UK has a big cocaine market, that's for sure, and that's confirmed, but it's not as big as the rest of Europe or the whole European Union. UDA estimated the total demand for cocaine in Europe in 2022 to be somewhere between 130 and 190 tons. But at the same time, in 2023, we seized over 420 tons in total in Europe. So as you can see also, numbers don't really add up. Important to say, we don't know how much of the cocaine we seize in Europe was supposed to stay in Europe. Europe is also a hub. Europe is not only a destination market, but Europe is also a hub for other world regions. So that's another factor to take into consideration. So at the end, the answer is, unfortunately, we don't really know. Next, please. Next, please. Colleagues from mafianeindanke asked me to delve a bit deeper into the criminal actors behind the cocaine market. And again, that's also it's not so easy because the cocaine market is huge and it has been growing. And the cocaine market in Europe has been some sort of like the Champions League of organized crime in the last years. Everyone wanted to have a piece of the cake because there's no other drug market where you could make so much money. Cocaine, as EUDA colleagues will probably say, is the second most used substance in Europe, and it has been growing and growing. So there's a lot of money and there's a lot of different criminal actors. So it's quite often when you look at German cases that go to court, it's not like you would say, okay, this is Ndrangheta, this is Western Balkan groups, this is Mokro Mafia. Very often it's just some random organized crime group who also want to have a piece of the cake. And this market has become more accessible, mostly through digitalization in the last year. So I will just focus on a few key criminal actors. When we look at when we start at the beginning of the supply chain, you see that there is an increasing presence of European organized crime groups in Latin America as bridgeheads and cocaine brokers. And I think that's an important aspect because we often forget about it. We think about all the foreign criminal actors that are active in Europe or in Germany, but we don't really think about the sort of export of criminal actors we also have. Italian organized crime groups and 'Ndrangheta and Camorra were the first really to build this sort of bridgeheads in Latin America, to have a capability on the ground and networks that were able to source cocaine at cheap prices, ship the cocaine to Europe, mostly still directly back in the day, and then basically could get a bigger share of that whole cocaine supply chain you saw before. So to intervene at an early stage in that supply chain, and the earlier you can intervene, the cheaper you get the cocaine and the more you can actually make when you are then in Europe. In the last years, following that, we saw the presence of Western Balkan organized crime groups quite a lot in Latin America, particularly Albanian-speaking organized crime groups, for example, in Ecuador. I will get to that later, that basically did the same thing, often in cooperation with 'Ndrangheta at the beginning, and now quite often we see Western Balkan organized crime groups acting alone, basically as a service provider for other European groups and selling the service of brokering cocaine deliveries. What you may call a third wave led to a further diversification. So now you see cases of Dutch, of German. Yesterday, there was a case of Polish organized crime groups sitting in Latin America and organizing cocaine supplies. So this idea we have quite often, mostly coming from Netflix or maybe from Pablo Escobar, about like the big boss heading like managing a global cocaine operation. You rarely find that nowadays. So you see mostly a principle at work that has been, covered quite often in the last years. It's called crime as a service. So basically you have now you see a transformation of this more centralized global cocaine market towards a very flat, not hierarchical networks that interact and the sort of compartmentalized structure. So back in the day, if you were based in Germany and you wanted to get a hold of cocaine in bigger amounts, you would probably need to travel to Latin America or at least to southern Spain to get like the right contacts and actually the ability to access this market. Nowadays, due to mostly encrypted communication and to digitalization, you can just stay where you are and you can organize that you get a hold of a cocaine supply because of this diversified and service-oriented structure that has developed. Next, please. This slide gives you an overview to underline the point I just made about the diversification of European criminal actors that you see in Latin America. So these are from the past 13 years, European criminals arrested in Latin America in relation to the cocaine market. Just to give you some idea, I won't go into the detail. At the beginning, you can see there's a lot of 'Ndrangheta members being arrested. That is still happening, yes, in Latin America. But you also see, like lately, you have several German fellows being arrested in Latin America, several Dutch ones, other Europeans. So you do see that there's a diversification. And of course, the boom of the cocaine market of the last years in Europe has also led that more and more organized crime groups try to intervene earlier in the supply chain in order to make more money out of it. Next, please. This is taken from our Southeastern Europe Observatory at the Global Initiative from the Western Balkan team, from a report about the presence of Western Balkan organized crime groups in Latin America. And this is not people being arrested from Western Balkan groups in Latin America, but actually members from organized crime groups from the Western Balkans being shot in the last years in Latin America. There's a lot of turf in the cocaine market. There's a lot of competition. Competition tends to be translated into violence in illicit markets. So you see only in Ecuador, you see 7 members of organized crime groups from the Western Balkans being shot in the last years. Next, please. This is to underline the point I made on digitalization. We do, within the framework of this European Drug Trends Monitor, we do a lot of monitoring of dark web pages and Telegram channels and other social media platforms. And there you can now find service offers. For example, here someone is offering that to produce cocaine bricks cut with procaine, in that case, lately a typical cutting agent of cocaine. You can get basically all the information and services that you need to run the cocaine business. People ask, how can they launder the income? How can they make the bricks? How can they decrease purity to make more money? And very often it's also, how can you get a hold of 10 kilos of 20 kilos of 100 kilos of cocaine? As you see, the person here in the Netherlands is basically saying big amounts only. And then you can directly contact through Signal that person and can probably get, I don't know, we don't know, we didn't try how big actually the amounts are that you may get, but as you can see, it's way more accessible than it has been a few years back. Next, please. How else do criminal actors respond? There's another trend that we see. We still have seizures of cocaine in European ports, of course. It's not that that's going away, but we have less seizures of really big amounts. So this is data from the Rotterdam Seaport Police. So you can see that in the last years, smaller loads of cocaine under 100 kilos have increased massively, while the ones bigger than 1 ton have decreased considerably in the past years. So that's also strategy, of course, how to minimize risk is avoid these very, very big seizures. I know just a few weeks back, we had a 30-ton seizure in close to the West African coast by Spanish police. I'll get to that in a bit. And also recently, Wilhelmshaven, you mentioned, you did 8 tons of cocaine, but that boat was not supposed to come to Wilhelmshaven. It had another route, but due to bad weather, it ended up there. So yes, it's still happening, but it's also going down. Next, please. Another strategy how you can reduce your risk is you move away from the typical container vessel. We have here from the Maritime Analysis and Operations Center Narcotics, also based in Lisbon. We see what are the most frequent seizures vessels used when cocaine is being seized, and you can see, and they do not focus on container ships, to be fair, but you can see like sailing vessels, for example, something which completely not happening in our discussion here in Germany, for example, has the biggest share of cocaine seizures on the Atlantic in the area that MAOC is covering. Next, please. Another trend that we see, and we believe there's ground to assume that this is sort of like the kind of like big thing now that we see in European cocaine trafficking. We see that a lot of unloading of cocaine is happening at high seas, and then go-fasts are being used to bring the cocaine to the shores, especially in southern Spain and also in Sicily. This recent seizure allegedly linked to Jos Leidekers, one of the most searched after fugitive criminals of Europe, from a Dutch fellow who is now based in Sierra Leone and is a long-standing cocaine trafficker. He is allegedly linked to this 30-ton seizure, and that was just a simple boat. It didn't leave anything to disguise it. That was supposedly should have been unloaded either close to Spanish islands or close to Libya. That was the destination port. And this is a new trend because it completely avoids ports. And this could in part explain why we see so much cocaine on the European markets. For those of you who are interested, our West Africa team, together with the Europe team at the Global Initiative, has written this very interesting report about the Arconian operation. The ship was called Arconian with these 30 tons. And actually, Judith, for you and colleagues, may be interesting. There's also a link to Germany, actually, to German companies based in Flensburg that were selling these ships to Sierra Leone. So I think we are just recently uncovering a complete new dynamic in the cocaine market, something we call the third wave of cocaine trafficking, because it basically offsets the efforts that we have done in Europe in the last years. Next, please. And my final slide. A final strategy that we see from criminal actors is what you may call nearshoring. So you see that more and more steps of the cocaine production and also of the whole cocaine industry are now happening in Europe. So in the last years, we have seized more and more cocaine labs in Europe. That doesn't mean that coca leaves are being brought to Europe to be processed into cocaine. But here are just some examples from different European newspapers. But we have cocaine labs being used to extract cocaine from other materials. Cocaine is built in or dissolved or put on other materials. And then you need basically a laboratory capability to extract the cocaine again. We have seen that more and more. And this is also, of course, a way how you can reduce risk for organized crime. And at the end, what you can see here with all the different strategies, how criminal actors respond to control this, we don't have one dominant strategy, but you have simultaneously, you have several patterns that happen at the same time: geographical diversification, better concealment, chemical routes, other entry points, other vessels, port avoidance strategies. And this is all coming together and makes it so difficult, because the subtitle of the event was how to stop the cocaine wave. We're not going to stop it, but of course we can make it more difficult. That has worked out well with the ports. But again, we have to catch up, because as prices signal, we are not there yet. So I'll leave it there. Happy to respond to any questions, and thanks for the invitation. And Judith and colleague, thanks again for having me here.
Thank you very much, Daniel. Thank you for your overview over the global cocaine market and about how it has changed in the recent years. And we can see the problem is very big. We will still try to get into some answers and understand how we can react. And with this, we get to Dr. John Collins. He is the Director of the Academic Engagement at the Global Initiative Against Transnational Organized Crime. And John also serves as Editor-in-Chief of the Journal of Illicit Economies and Development. And he's also a board member of the International Society for the Study of Drug Policy. So we will speak about policy actions to work against the cocaine market. And as I said before, unfortunately, he was not able to join last minute, but he did record his presentation. So we will have the opportunity to watch it together now.
Well, good evening, everyone. I'm very, very sorry I couldn't be there in person. I had a change of a medical appointment today, which I sadly was not able to avoid. And I'm really sorry I'm going to miss the discussion and to be able to answer some of your questions. And my colleague Daniel is there. He has a terrific, long expertise in drug policy and drug markets. And he's very kindly said that he's happy to answer field questions that may come from this presentation. And Daniel has a false modesty sometimes. You would know it by looking at him, but he really does. But he has a tremendous expertise on this. I'm going to give an overview of the policy perspective on what we've learned from enforcement and drug policy more broadly over the last century, even we could say. We have a huge amount of experience on what you intervene in drug markets, what we can expect from policy, what are the potential outcomes of taking action from a supply side, and perhaps to a lesser extent from a demand side. So the first thing to say is people dismiss law enforcement against drug markets saying it's ineffectual and it's counterproductive. That's half the story. Law enforcement, as I'm going to highlight, is quite limited in what it can achieve against established drug markets. But from our organizational perspective, we have to also recognize that law enforcement does have an essential role in containing organized crime. Organized crime is a product, is fueled, and in some ways, in many ways, a product of the illegality of drug markets. There's a lot of profits to be made, and they form an organizational function around meeting supply and demand within illicit drug markets. So law enforcement has a key role in actually containing the expansion of organized crime. Can't prevent it. It can't eradicate organized criminality or the criminality associated with drug markets. That's inherent in the kind of policy framework that shapes drug markets. But it has to exist and has to work to contain organized crime. And I'm going to highlight a European Commission report, which I worked on, I think it was last year, maybe it was the year before, where we looked at this. And there was a sense that we were saying, well, law enforcement has no role. That's absolutely not what the outcome in the saying is that law enforcement has a really key role in this. Also, even if we were to think about legal regulation, which Germany has experience of to some degree with the cannabis market, or Canada, the US, and other places, law enforcement has a key role after a complete regulatory shift, right? It changes its focus, which is about protecting the illicit market and trying to eradicate the illicit market or the illegal market, but it even retains a key role then. And what we need to look at then is distinguishing between, especially under kind of a prohibitive system, where if you're looking at something like cocaine markets, what's the difference between tactical and operational gains versus strategic gains, right? Strategic gains are about trying to shrink or really undermine the illicit market. And tactical and operational gains are more about what can law enforcement do to shape those markets and reduce the harms to some degree of the criminality that comes from those markets. So can law enforcement achieve strategic goals around drug markets? It depends. If it's around preventing impunity for criminals, Europe has a long history of this. Yes, we have very few cases or situations in Europe where we could say criminality is a significant threat to the state. We hear securitized language about how parts of Europe may be becoming narco states. I do not believe that's correct. When governments in Europe decide to target certain criminals, they are very effective at bringing pressure on them and eventually crushing them. My own home country, Ireland, has shown this in the case of the Kinahan cartel, which has effectively been progressively dismantled, maybe too strong a term, but has been severely undermined and effectively in some ways broken up over the last number of years through coordinated law enforcement activity. If the goal of law enforcement is to prevent corrosive criminal hegemony, which is effectively where criminals gain so much control over a market that they can exert corrosive political, geographic, community control over areas they operate in because they're so wealthy and so connected, and they have spread their corruptive wings so far, law enforcement has a significant role in preventing that. Italy is a great example of this, right? The mafia-style organizations have been under significant pressure over decades, to the point where it's very hard for them to exert any kind of obvious hegemony in markets. If the goal of law enforcement is to reduce market violence, the answer is it depends. Law enforcement can reduce market violence if it is operated in a very strategic, targeted way. But law enforcement against markets can also provoke violence. We know this, right? The famous balloon effect is an example. You shift it around, but also the kind of hydra-headed fragmentation of criminal entities, where you not only have criminal entities fighting for terrain against the state, but they go to war with each other. They go to war internally, and factions form and groups go to effectively fight each other. We know that this often leads to an uptick in violence. So success against criminal actors or markets in some cases can actually lead to a perverse outcome, which is more violence and more problems. Can law enforcement reduce the size of drug markets? And this is a key question as we look at cocaine markets in Europe. The answer, frankly, is almost never. We have very, very little experience globally, especially around established markets, that persistent law enforcement efforts against those markets actually reduces their scale. They're just too diversified. They're too complex. They're driven by economic forces, supply and demand, and trying to undermine those is very, very, very difficult. And so we need to be realistic about what we can expect in terms of outcomes as we develop more capacity to try. And in some ways, many would say the idea of controlling an illegal market is nonsense, and it's just a fool's errand to even attempt it. But obviously, politicians and enforcement in Europe wants to take action against these large-scale cocaine markets and other markets in Europe. So what lessons have we learned from that? We have, as I said, a very long empirical basis to evaluate this. We have a solid theoretical basis to evaluate this as well. The theoretical basis is just fundamental economics, right? Markets find a way. The empirical basis is we've spent huge resources, whether in the Americas, in Europe, and other parts of the world, Afghanistan and others, in trying to reduce the size of markets, and we've seen very, very, very limited results. There is an exception, which I'll come to. So if we very quickly look at the micro and macroeconomics of the supply side, the key is these are two reports that we worked on when I was at the London School of Economics. They were economics focused commissions looking at experience of regulating and prohibiting drug markets globally. We have to distinguish between marginal and aggregate, right? At the margin, we're talking about the additional enforcement that we do. At the aggregate, we're talking about the overall market when you add all of this together. And so what we can say is that at the margins, enforcement against markets, especially established markets, right? Diverse established markets. We're not talking about an NPL, a new psychoactive substance, where a successful enforcement intervention actually can have a significant impact on that market trajectory. We're talking about established, developed markets. The additional enforcement you do against those is very, very limited, right? So would 20% more law enforcement efforts against the cocaine market make a demonstrable impact on the size of it? Well, probably not, right? Because we're dealing with goods that the demand for them is, to some degree, we can debate elasticities around drug demand, but effectively we can say they show some semblance of being inelastic goods, right? Cocaine is a luxury good. It doesn't respond to prices as normal goods do. Actually, the price and the quality is a real sign of ostentation. It's an ostentatious sign. And so people demand it because it's a luxury, expensive good. It's a status symbol in a lot of circles. On the supply side, we're dealing with renewable global commodity chains, which are price sensitive, right? So effective enforcement against one part of the commodity chain does not stop it. It just shifts it, right? And because they're diversified, there are other ways that can take up the slack over time. Producers, suppliers, they all respond to price shocks. So if prices increase because of an enforcement activity, we can assume more suppliers will come into the market. And that's the underlying theoretical basis for saying that, well, actually doing more doesn't necessarily produce better outcomes. Two very famous drug policy scholars, Peter Reuter and Harold Pollack, did an article in 2014 looking at all the metadata around, it was a meta-analysis effectively of all data looking at if there is a police intervention, do we see an increase in prices? And they said effectively, no, we don't see any evidence that more policing leads to higher prices. If prices are not going up, then you're not having an impact on overall supply in the market. Now, that's very different from the aggregate argument, which is effectively saying, well, does continued prohibitionist policy actually reduce the scale of drug markets overall? And the answer, as far as we can tell, is probably, right? Many would disagree with this and say, well, you could have the same effects by increasing taxation and regulating, controlling the market. We just don't have any empirical data to evaluate that kind of contention to any satisfactory degree. But what we do probably know, and this is John Calkins, another very famous scholar, has done a lot of work on this, is that prohibition makes drugs very, very expensive, right? The reason that cocaine might be 120 euro a gram versus 6 euro a gram is because, well, you can't just put it in a FedEx package and ship it across borders, right? You have to actually smuggle it. There's a huge markup to being able to cross territories with it, and there's a risk premium, et cetera, et cetera. And he compared things like coffee, a high weight to value ratio, similar to cannabis, or silver, a high value to weight ratio, similar to cocaine. And he showed the difference in markups because of prohibition, right? Cocaine, you're seeing a 6,500% markup, whereas silver, you're seeing a 9% markup. So this is the study that we did as part of the funded by the European Commission. We did it in partnership with RUSI, and we looked at various examples of enforcement against drug markets around the world. The SCI-CC case in Europe, which I think is particularly telling. We looked at Ireland over a 20-year period since a very famous assassination. It was actually the 30th anniversary, I think, last week, the assassination of journalist Veronica Guerin. It was 2 weeks ago. Which provoked a massive state response against organized crime. What did we see? Organized crime certainly suffered. The main actors involved were eventually brought to justice, but it had virtually no impact on drug markets in Ireland. And we looked at a number of other cases. Mexico is obviously a very, very well-known case of you cut the head off one cartel and it provokes chaos. And that leads to kind of an exponential growth in violence in Mexico over the last number of decades. So this was the main findings of the report. The findings are stark. In no single case we evaluate have major external shocks or disruptions through enforcement or lack thereof been shown to have any demonstrable lasting impact on global drug markets locally or globally, right? That's quite frightening, right? It's effectively saying despite everything we've done, we've shown no control over the economics of these markets. We can control the actors in the markets to a degree. When the state goes after them, their life can become very difficult and eventually they can be brought to justice. But we show no actual ability to demonstrably impact these markets. We also find that this contention that enforcement always leads to violence, not necessarily true. In a European context, probably less likely because the state can put so much pressure on so many different levers. But when we see cases where states have limited societal resilience and state capacity, we can see that enforcement does often worsen violence and societal disruption. In places like low governance zones within Brazil or in parts of Mexico or Colombia, enforcement does often lead to an uptick in violence because it creates chaos, it creates uncertainty, it removes power structures, it disrupts the political economies of the areas it's operating in. But this is effectively what we've seen. I'm not going to go too much into the cocaine market because I know Daniel has done a lot of work on it. But what we've effectively seen, even against the backdrop of SCI-CC and some of the EncroChat successes, which we have to call them, were extreme successes on behalf of law enforcement, absolute idealized type of enforcement activity. It's not low-level drug market activity. This is intelligence-led targeting of high-level actors within drug markets. Huge outcomes in terms of arrests and disruptions of criminal gangs. Did we see any major impact in European drug markets? Not really. We saw some disruptions to supply chains and movements, etc., but we saw no major reduction in the scale of the market. That is, again, sobering, because frightening to some degree, sobering for sure, because it really shows the limitations of what we might be able to hope to achieve. We looked at the case of Ireland, and I'll just give some quotes by a service provider who worked with drug users in Dublin, who I know it well and I've worked with many years. Over the past 25 years of intense enforcement, we have more drugs in the street, they're more potent, and there's more harm. Regardless of the best efforts of law enforcement, I've never heard anyone saying over those 25 years that we can't access particular drugs, right? So as we think of new policy approaches to managing the European cocaine market, I think we need to really keep in mind what has and has not worked over the last number of decades. And we have a cyclicality to drug policy. My background is actually, I'm a historian of international drug policy. That's and that's where I've had most of my career focus. And you see the Mark Twain quote, history doesn't repeat itself, but it rhymes. you see the same stories again and again, right? You see a kind of a market reaches a kind of peak and it becomes more manageable, and societal interest starts to dip. And so you see space for more pragmatic and more kind of health-oriented approaches, etc. The panic goes out of that market, and that goes into decline. And that it opens more policy space. And then you see another wave of increasing drug use or drug supply. And that sparks in a sense of, well, enforcement has to come in. We have to try stop this market and reduce it. And so we go through the same policy cycle again and again over the last century. Again, I won't go too much into the cocaine market. So what are some of the implications of this? And I know I don't have time to go into, well, let's talk about public health responses. I know others in the panel will be able to do that extremely well. But so I'm going to stick, again, just mostly to the enforcement side. Sorry, I have dogs here. So law enforcement can alter criminal dynamics, but has no discernible impact in supply and demand in mature markets. Markets and organized crime structures show tremendous resilience in response to external shocks, right? So we have to understand that drug markets in Europe, they're not hierarchical. You take, the kingpin strategy, you take out the top level and the organization might fold. That's nonsensical in the European context because there's such diversified, complex market structures and organizational structures. A key function of law enforcement, and I think this is really key about shaping what we're aiming to do with law enforcement, is that we want to remove the most harmful criminal actors. That's a given, right? You want to make sure that criminal actors don't feel like they can actually challenge the state or establish what we term in the report corrosive hegemony. And then we also need to take account of different governance capabilities, right? Italy has evolved a very different response to organized crime over the last number of decades than other countries have. That results in different outcomes from enforcement activities and different capabilities of managing those things. And so we need to just take account of those things. What are the policy implications? We need to increase, obviously, efforts to disrupt drug trafficking networks. Network disruption, for all its flaws, is probably the best thing we can do. Market reduction, an admirable goal, is we don't have a huge amount of evidence to assume that that's a suitable policy. Asymmetric enforcement strategies, we've talked about these a number of years, and focused deterrence. These are really, really key ideas, that you're not targeting in a symmetrical way the entire market or all actors in the market. You're targeting the most corrosive, problematic actors within those markets, and you use that to shape the market. Violence is what draws enforcement attention. Overt corruption, overt engagement with attempting to intimidate journalists or politicians or whatever it is, or judiciary, whatever it is. Those sorts of things are really key. Expanding public health approaches. This is something that we know works, right? That's public health is, we're blessed in the European context that this is something we can consider, where we integrate them into what are effectively very well developed social safety nets. But these are one of the key ways that we have to try expand our harm minimization of these markets. Development policy, that's a key one. Daniel could speak to that, I think, how we could mainstream this within a development approach, which might actually have some impact on the production and transit points. And then experimenting with incremental legalization. I'm fundamentally a policy incrementalist, right? We're learning a lot from cannabis legalization at the moment. It's not flicking a light switch. It's not the answer to all our prayers, but we're learning a lot about what it is to shift from a fully illegal to a legal market. Cocaine is a totally different kettle of fish, right? We have no notion of what it looks like to regulate a stimulant market, which is non-satiating, right? Which is people can really overconsume. And if you see a drastic price collapse, that can be extremely problematic. Just like if we have a glut of cocaine flowing into Europe. But I think the regulation discussion has been more mainstreamed, significantly more mainstreamed. I think it's a very important part of the discussion, but I don't think we should ever be looking for we shouldn't be looking for silver bullets either way. Prohibition is not a silver bullet. Enforcement is not a silver bullet. Legalization will not be a silver bullet, but it has to be part of the discussion going forward. And I will, with that, I will leave it there. Thank you very much. I am really, truly sorry I missed the event, and I look forward to hearing from Daniel how the discussions went. So thank you very much.
So thanks a lot to John Collins. It was almost like having him here. And it was truly impressive in a negative way to see how resilient these drug markets are, and interesting to see what law enforcement can achieve and what it cannot achieve. And for this purpose, we want to look outside of law enforcement, and we will do that with Joella Anupol, who is our last speaker. She is a psychologist with a background in community health promotion and social and healthcare research. And now she's currently a scientific analyst for health promotion and crime prevention at the European Union Drugs Agency, EUDA. And she has worked with universities, NGOs, local governments, and European networks to do all kinds of drug use prevention initiatives. And I'm looking forward to hear from you, Joella.
Can you hear me now?
Yes.
And do you see the presentation?
Also, yes.
Okay, great. So thank you, Judith, and to mafianeindanke for the invitation. And it's a pleasure to be part of this conversation with the colleagues from Global Initiative. So we have already heard about the global cocaine market and about drug policies. And as it was being anticipated, I'm bringing the public health perspective. So what I like to do now is shift the focus away from the market and the policies and more toward the people and the communities who live with the consequences of the drug market. So now, so the title of today's webinar asks whether we can stop the cocaine flood. And from a public health perspective, I would like to offer a different question to answer. So more people-centered. So how do we prevent and reduce the harms that cocaine creates in our communities who live the consequences? And that is exactly where health and social responses come in. So today I'll present 4 topics. Firstly, how communities are actually affected. Second, what the evidence tells us works. Third, I'll focus more on what are place-based and community-based prevention approaches, and then some takeaways and what civil society can do in this community-based prevention field. So starting with the current situation, Europe continues to experience, as we've seen, historically high cocaine availability, and mentioning some data from the European Drug Report launched last month. In the last year, EU member states reported around 97,000 cocaine seizures, amounting to roughly 330 tons. And although this quantity seized has decreased compared with the previous year, the number of seizures actually increased. And that tells us something important, that drug markets adapt and trafficking routes change and new routes and methods emerge, as we've seen with the previous presentation. So cocaine doesn't disappear, it moves. The market adapts quickly and the harm keeps affecting our communities. And on the demand side, cocaine use remains high. If we focus on the young population, so teenagers and young adults aged 15 to 34, 2.5 million of them used cocaine in the last year, and several countries are reporting higher use than before. And in the most recent European school survey, on average, 2% of 15 to 16-year-old school students have reported having used it at least once in their lifetime. And the treatment demand is rising too. Around 37,000 people entered specialist treatment for cocaine for the first time, making it the second most common reason for entering drug treatment in Europe. And who is most affected by the cocaine flood? Cocaine markets affect far more people than those directly involved in trafficking. The people most affected are often those who never chose to be anywhere near it. They simply live, work, or grow up where the market operates. And what they're exposed to is drug-related violence, perceived lack of safety, and the gradual normalization of drug trafficking, drug use, and violence in their surroundings. So think about who lives with that, residents, families, and children who see public spaces they share become less safe, and they may see that drug trafficking and the related violence becomes part of their neighborhood. And then thinking about young people, they can be, and teenagers, they can become targets for involvement in criminal networks who offer them money, status, and a sense of belonging in a group. Local businesses, they can be affected by theft, vandalism, or threatened or pressured to close. And thinking about people who use drugs, of course, they are the most exposed to it all. They are exposed to serious health and social harms. And then we have the people responsible of the responses. So we have the frontline workers, including health professionals, teachers, outreach workers, police, and the local institutions themselves, who are already facing too much pressure to confront this situation, and often they work with too few resources and too little support. And talking about all the harm that drugs create, this is not spread evenly, because drug market violence, it concentrates in neighborhoods that are already facing a complex social disadvantage, including poverty, poor housing, social isolation, and fewer opportunities in general. And we see the same pattern at the market's entry points, where markets are exploited, corruption, intimidation, and violence follow. And in some countries, the competition between groups drives gang violence and even homicides in some countries. So this violence is not random, and it's not about the people who live there. It's produced by the interaction of people, places, and structures. So why communities, some communities are more affected? Because the same social conditions that produce poor health also produce or also can explain crime and violence, because these determinants overlap. And social disadvantages, complex social disadvantages, raise the risk of involvement in crime, and at the same time, this shows up as repeated demand on health, social, and criminal justice services. So from a sociological perspective, these are community level issues, and these are social conditions and physical conditions that we should tackle. And as said before by the other colleagues, this is a public health problem also. And also cocaine is now the drug most often involved in emergency room visits for acute drug toxicity cases, and around 1/4 of these cases are mostly men in their 30s. And cocaine was involved in about almost 30% of drug-induced deaths last year, and most of the cocaine-related deaths involve polysubstance use. And the treatment demand is up nearly 40% more. So 40% more people are seeking help for the first time since 2018. So knowing all this, what do we know about what works with tackling the current situation? So the evidence from crime reduction, what we know is, for example, in problem-oriented policing, where the police analyzes a specific problem and they tailor the response to it, it produces moderate reductions in crime and disorder. With focused deterrence, which pairs enforcement with social support, it shows the strongest results, especially for gang and drug market violence. And hotspots policing, which means intervening in specific places where violence occurs, gives as well, shows as well small reductions in overall crime and disorder. And then we also have those that are called asset-focused interventions, meaning seizing and confiscating criminal profits. So far, they show little evidence that it reduces organized crime, although it stays popular as an intervention. And the strongest results in crime reduction, what works best, is a whole of society approach, understood as that not one single sector can tackle the complexity of drug-related issues. So, for example, enforcement works best as part of something bigger and in partnership with other stakeholders in public health and with the local communities. So then moving on to crime and drug use prevention, as crime, drug use, and violence share determinants, the most effective prevention acts before the risky behavior even takes place, so before the risk factors that predict it settle. And we can act on those risk factors at every level. We can think about the macro level, so intervening at the physical and social environment. We can think about the micro level, so the family, school, and peer influences, and at the individual level, which gives us the three main drug use prevention frameworks, which are called individual, developmental, community, and environmental prevention. And we need all three frameworks. They just operate at different levels and address different mechanisms. The real challenge, especially for community and environmental prevention, who show beneficial results in the long term, is that they require cross-sectoral, multi-agency action. In regards of developmental prevention, the programs within this framework, what works are those focused on life skills training in children and adolescents. So to support better our communities and tackle harms they are exposed to, we need comprehensive interventions that address individuals, community, environment, and the context altogether. And for this, we have the place and community-based approaches. And we must see communities are not just where the harm takes place, they are also where a lot of the solutions are. And evidence shows that coalition approaches done alongside with good planning and evaluation, and including best practices in health promotion do influence community outcomes. And other factors to take in is that this approach works best with co-producing with the local stakeholders. And for environmental prevention, so that means changing the surroundings and facilitating safer public spaces and activities and alternatives for young people also works. So in general, it means tackling the harms communities actually experience. And we have a concrete example with the Communities That Care model, which brings everyone to the same table. So policymakers, the police, schools, public health professionals, businesses, families, young people, and so on. All setting priorities together based on local data about risk and protective factors in the context. So its principle is simple, is that no single organization or sector can guarantee the healthy development of young people. It takes the whole community. And this is a tested community planning system to prevent multiple problem behaviors in youth, including violence, delinquency, substance abuse, school failure, and depression, by tackling these common underlying risk and protective factors through strengthening of community coalitions and implementation of evidence-based programs. And it is a model that delivers. Where it is implemented well, we see stronger, more effective coalitions and more evidence-based prevention, and more on the outcome side, lower substance use, lower delinquency, and lower violence, and better well-being for the young people in these communities. And the communities that care is being implemented in Germany with promising results. And for example, in a recent evaluation, it has showed an increased adoption of evidence-based prevention through local coalitions in Lower Saxony. Then, as I've mentioned a bit, environmental prevention, it means limiting the opportunities for unhealthy or risky behavior, and to promote the availability of healthier options. And this happens by changing the environment. And more on place-based approaches that they seek to change the social and physical conditions. What we know works best is investing in services, employment, changing the physical environment and community infrastructure at the same time, to address all these multiple risk factors. As well, what's called now third generation crime prevention through environmental design. What works best is with the changes in the urban design. This should be done together with the local residents. So investing in disadvantaged places is also crime and violence prevention. And place-based approaches to work, they need the changes or the support at 3 levels at the same time, from top to bottom, from the government and investment and coordination level to supporting collective resilience to the physical environment and specific places, to intervening in these specific places levels. So the message is simple with place-based approaches, because where all 3 levels are weak or not coordinated, organized crime takes root, and where all 3 are coordinated and active, prevention does. And a bit on the crime prevention context in Germany from a summary from the European Crime Prevention Network. What we know is that in crime prevention in Germany, they agree mainly on 3 things. Is that enforcement remains essential to tackling crime effectively, but that at the same time social, community, and situational crime prevention still have a lot to offer. And in the end is that crime prevention is understood as a shared responsibility, as a whole of society task. And the infrastructure for crime prevention in Germany is already there. There are around 2,000 crime prevention bodies across the country. The challenge is to use them effectively, to give them the resources they need, and the long-term support, and evaluate the impact of their work. So last, as takeaways, if there's one thing the evidence asks of us, is this sustained collaboration between the health and the security perspectives. And then if we could prioritize 4 things. we should prioritize protecting young people by facilitating early support and alternatives that cut off potential involvement in the criminal drugs networks. The EUDA has recently published a review on addressing this involvement. Then we should support community coalitions and place-based approaches, and joining up stakeholders is very much needed with public health, police, schools, families, civil societies, and so on, sharing data and co-creating responses, because responses work best when the people, the places, and the organizations affected help to shape them. And I think that is exactly where civil society organizations come in, because civil society organizations bring reach and trust, and they are in contact with the people that most services don't reach otherwise. They give a voice to those affected, and they can be partners in co-designing local responses from the start. So that is from my side. Thank you, and I look forward to continuing this conversation with all of you.
Thank you very much, Joella. Thank you for helping us widen our perspective and think about the entire communities that are affected by drug markets. And yeah, I think your presentation helps us to accept the problem as complex and look for solutions that can address the situation that is as complex as this. So now I open the floor for questions. So if any one of you has a questions, feel free to either raise your hand or write it in the chat. And if you can also direct it directly to one of the speakers so we know who it's for. And I can see already that there is a question in the chat. I'll read it for you. Just wondering if you have also done research or plan to focus some research concretely on crack cocaine markets, or is the cocaine market representative already? It is indeed quite concerning to see how major cities in Europe are being visibly flooded and especially having a huge impact on already vulnerable populations. Who wants to take that on? Please, Daniel.
Yeah, thanks, Judith, and thanks for the question. I'm not sure. I did not say that, but maybe for everyone. So crack is smokable cocaine, and but there is no independent crack wholesale market or crack trafficking, because usually the conversion from cocaine into crack happens at the end of the cocaine supply chain. So users would basically cook their own crack. Or there is a bit of retailing of crack, so-called stones, that you would see, but it's really at the end of the retail chain. So you cannot really research that market beyond, because it's not separate from the cocaine market. So anything that you have heard from my presentation and also from the other presentations on the cocaine market, at the end also apply to the crack market, because the crack market is just becoming a crack market at the end of the cocaine supply chain. Hope that's clear.
Thank you, Daniel. Anything you want to add, Joella?
From a public health perspective, we do have data on treatment entry for crack cocaine, and I will share this information in the chat. But yes, this is also something that we are monitoring in treatment.
Thank you.
It's not really a market's answer, but more from the public health perspective and treatment.
Okay, thanks a lot. There's another question, which I think is actually 3 questions in one. So I'll read them to you. Is the comparison with others and the feeling of inferiority that people feel in the addiction to social media a possible cause to the increase of demand and consumption of drugs? Are there any policies used by the European Union to teach teenagers and young adults about emotional intelligence and management of emotions in schools to prevent the use of drugs? And the world moves more and more towards artificial intelligence and the digital. Is this a possible cause for people's demand for drugs in the future? Joanna, do you want to take that?
Yes, I can answer. So about the first thing, so we are talking about different things. So one thing is addiction to screens, social media, gaming, gambling, and so on. And then the other side is substance use, right? And then the second question is, are there any policies? I can't talk about policies, but there are programs, school-based prevention programs that are mostly about emotional management and life skills training for teenagers that do tackle emotional intelligence and having the skills of, saying no to substances and have a better, let's say, decision making regarding your leisure time. But as a policy, I don't know, used by countries. And do I answer your question, Tiago?
We also, I don't know, Daniel, if you want to add something.
No, not on this one. Thanks.
Okay. Then let's see. Okay, Tiago said yes,
Yes,
so
okay.
perfect. Then we have
But
another question.
I do sorry, I want to add something else. I do agree. If we talk about how environmental prevention can be adapted to the digital world, we need more regulations on how all the digital world, I mean, social media is being used, or how accessible it is for teenagers, and because we cannot control what they see and how engaged they are becoming more engaged in using the technology. So yes, this is now a trend, how to regulate digital use. This is what I can say.
Thank you. Yes, indeed. It's a big discussion also in Germany about whether there should be laws, especially for young people and the use of social media. There is another question, and it says, could you elaborate on the 2000 crime prevention bodies already in place in Germany? Thank you.
This is a report from the European Crime Prevention Network, and they have this information with more detail. And also in Germany, there are annual conferences on crime prevention in Germany. So I can send that information also in the chat for Francisca to check with more detail.
Perfect, thank you. And then we have a question by Sandro. He writes, Nicola Gratteri, Italian anti-mafia public prosecutor, recently spoke about genetically modified coca plants that permit several harvests per year and thus raising cocaine production to an unknown level with many severe consequences. Do you have any information on these plants?
I can take that one. That's okay. Yes, I mean, the new thing is not that you can harvest the coca plant several times a year. That has always been happening, and it depends a bit on the altitude and the climate conditions, how often you can harvest the coca plant, because the point is that you don't harvest the fruit, but you harvest the leaves. So the leaves regrow, and you can harvest them quite often. But what is new is that you have new breeds that actually have a higher alkaloid load in the plant. So that means that from the same amount of coca leaves, you can extract more cocaine. So this has also led UNODC to adapt their methodology. And basically, even if coca cultivation was not growing, you would have more cocaine on the market. This is probably, and it's a lot of guessing in there, but this is also probably one of the reasons why we have this cocaine oversupply situation that we currently have. It's of course related to the expansion of cultivation in the last years, but possibly also to the better extraction methods and the higher alkaloid load in the plant.
Okay, thank you very much.
And maybe, sorry, Judith, maybe if I may add a point, a lot of people ask, like, where will this all go? I mean, a lot of people thought we would have reached market saturation way earlier, right? So we have, and you see certain signs that we do have an oversupply situation. I mentioned the decreasing cocaine wholesale prices in Western European countries. That would have been unthinkable a few years back. So yes, we do probably have an oversupply situation, but at the same time, we see all the indicators on the demand side in Europe, they're still increasing. So it's not really clear because it's becoming less lucrative for organized crime now. Because if you can only if a kilo of cocaine in Spain is only worth 10,000 euros and it was worth 30,000 euros a few years back, of course it's less lucrative, but we don't exactly know the balance of.
I think we lost Daniel. I hope he'll be back in a second. He was saying earlier that he had some internet shortages. You're
Sorry?
back, Daniel.
Okay, back, I think. Okay, I basically made my point. Thanks.
Thank you. Maybe just a quick question to follow up on this. As you're saying that the retail prices are going down, are there other substances which are about to overtake cocaine, talking about profits, that we should look out for?
No, not yet. Retail prices are not going down. It's actually wholesale prices.
Wholesale, sorry.
So what
Yeah.
we see, no, but that's an important point because what we see is basically at the retail level, you can more or less still sell the cocaine for the same prices because in a lot of countries, like in Germany, it has been 60 euros forever for a gram of cocaine. It's partly going down. In Belgium, Netherlands, it's always been 50 euros. But now you can buy the cocaine way cheaper, but you sell it at the same price. So the margin for organized crime has increased. There's no other substance right now that would compete in terms of financial turnover with cocaine. Yes, cannabis is more use, but the margins in cannabis are way lower. So for now, it's still the most attractive market and still the market everyone wants to be in if you want to make your money legally. But yes, we do see it's not. We speak a lot about cocaine, but the European drug market or European drug markets are way more complex. So we see kind of like a perfect storm because we see several trends at the same time and several shifts in these markets. So we do see that less cocaine, less heroin is coming to Europe because of the Taliban-imposed Afghanistan opium ban. We see the surge of synthetic opioids. We see an ongoing diversification of synthetic drugs, for example, synthetic cathinons that have been exploding in the last years, basically a trend coming from Eastern Europe, but also now in Germany, we see production sites and we probably also see, we don't really know, but increased use of these substances. So, and then we have a scattered situation with regards to cannabis. John mentioned that we have legalized cannabis, but we have not legalized supply. That's also a big thing for organized crime. So a lot is happening at the same time in Europe, and cocaine is just probably only the most visible trend that we see, where we do see major shifts, but there's a lot of sort of like perfect storm situation where we have several really threatening trends happening at the same time.
Okay, thanks a lot. We have another question from Thomas, and he says, thanks for the very interesting presentations. Could the decriminalization of cocaine be a new approach? Maybe that's for both of you as well.
I can start, Joella. I guess it's
Yes, of course.
that's not your favorite question. Well, I mean, when you look around the globe, what is like happening in terms of drugs, we see that few countries have moved towards cannabis legalization. I just mentioned Germany. Way back, we had Uruguay, we have Canada, we have US federal states. And then we have some pilot experiments across Europe happening with regards to cannabis in the Netherlands and in Switzerland. And we see mixed results, I would say. And as you can see from the German debate, there's a lot of criticism and it's not working the way it has been expected. And we don't have a legal supply, so people move to medical supply, but now medical supply last week has been constrained. So it is difficult. With regards to cocaine, there's we had a situation 100 years back when cocaine was legal in Germany. It was also invented basically in Germany as such, the extraction from the coca leaf, and then it was prohibited because of the negative public health consequences. We have had intents from the outgoing Colombian government, but then they basically pulled back to move towards cocaine legalization, and we see some elements of the cocaine market already being regulated. Not illegal, and basically cultivation is legal in some parts of the country. You can buy it everywhere, but of course not cocaine. I don't think it's feasible politically that anyone in Europe would seriously have a discussion about cocaine legalization, cocaine regulation.
I think there's some more issues with the connection. Maybe when Daniel is back, he can take up his points. But Joella, do you want to go in the meantime? Sorry, Daniel, we just lost you again. You were just at the brink of legalization and decriminalization regulation.
Yeah. Okay. So I don't think, to keep it short, I don't think it's feasible that we will have a credible political debate in Europe about legalizing cocaine because the public health harms are too big, especially of crack. And it's simply not the substance, not the situation to have a discussion about it. And there's basically no examples beyond cannabis that we could actually use, only going back in history 100 years, and where also other conclusions were taken and cocaine was prohibited.
Thanks a lot. Joella, do you want to add?
No, it's just to repeat, yeah, the public health harms are too big, and from our side, we observe what the outcomes are, regardless of what the legal model is in a country. And also, I want to ask Thomas, what do you mean with decriminalization? Because it ranges from, I don't know, removing penalties for possession or to diversion into treatment. So also there's this other side, what is intended for decriminalization. So
yes, indeed, it's a large field in between legalizing everything and just decriminalization of maybe minor quantities, or what we have seen with cannabis. So let's see if Thomas wants to add on his question in the chat later on. In the meantime, there's another question by Sabine, and she asks, is there any research concerning the effects of cocaine itself and on society? Why is it specifically this drug that's on the rise and becoming more popular? Who feels?
Should I start? I think Joella has probably more point, but there's a general trend in Europe towards stimulant drugs. Cocaine is a stimulant drug, and there's a lot of stimulant drugs are high in demand, and this refers to synthetic drugs, but this also refers to cocaine, and it's probably, I mean, you can just be guessing, but it corresponds to the times we live in. So in a very fast-paced environment, fast-paced working environments, you can see that cocaine is often being applied, and but it also refers to other stimulant substances. So that's probably one of the reasons.
Sabine is asking, research concerning the effects of cocaine itself is the question on the individuals, because I mean, cocaine, it's a stimulant related to cardiovascular risk, and of course the probability of depending on it is high, and then there are other mental health effects, and then the risks of it rise with the heavy use, and when especially it's mixed with other substances. And then, as I mentioned before, it is the drug most present now in emergencies, in acute drug toxicity emergencies, and now it's involved to almost 30% of drug-induced deaths. So that's the effects itself, right, on the individuals. And on society, the harms is what I covered today, from all the drug market related violence, the pressure on our health services, and then about why is it on the rise and why is it becoming more popular. We can talk about the high availability and accessibility to it. We can talk about now it's easier or cheaper to purchase, from that to really just the high availability, and that more and more it's becoming a more normalized substance to be used in different situations. So that's what I can add from what Daniel has said.
Thank you. And also for everyone, Joella has been adding several links in the chat if you want to see about initiatives, programs, events, and all that, if you want to see some more information on that. And then we also have a question by Karina Eggert. She writes, do you have information regarding altered routes used by OC groups, for instance, shipping containers from Colombia to Australia and leaving them there for 2 weeks so that they are subsequently classified as originating from Australia when entering the EU, thereby no longer appearing to come from high-risk countries?
Yes, I mean, this happens all the time, right? We see constantly this cat and mouse game and a reinventing and an adapting of organized crime. That is quite a frequent thing. I don't know particular case of Colombia to Australia and back to Europe, but I wouldn't be surprised because logistical costs that play a key role in illicit businesses usually don't really play a role in illicit drug markets. So you see all sorts of weird trafficking routes, crisscrossing sometimes across the whole of Europe, different cocaine shipments just to avoid detection. And of course, organized crime is constantly checking for less risky entry points. I showed that on the map before. So yes, that is happening. By the way, Australia is the most has the highest cocaine prevalence around the globe. So it's a very lucrative market. And even though it's very far away from South America, you do have a lot of cocaine trafficking going to Australia because you can make a lot of money in that market. And cocaine is quite expensive there. With regards to Germany, you see cocaine seizures. For example, in Scandinavia, they originate often in Germany. Of course, not the cocaines are coming from Germany, but especially applying the same tactic that you have just mentioned. That is basically rerouting, relabeling loads in order to reduce risk and basically fall through the risk priority list in these ports. And that is, of course, it makes a lot of sense for organized crime to do so.
Okay, thanks a lot. There is an answer or a specification from by Thomas on decriminalization. I do not mean that cocaine should be freely available, but the question is whether people who use cocaine would not, under certain conditions, prefer to obtain it legally rather than through organized crime. The illegal market is what enables organized crime to make such high profits. Okay. You look like you want to say something, Joella.
Well, the first thing I would say is that we don't even have it's impossible to have the full picture of the cocaine market itself, because it's through scale and availability. We only see part of it. So how can we regulate something that we can't fully see or measure? So this is something I can say.
Yes. I think maybe, Daniel, this would be a point for you. Would it even be possible to provide cocaine legally? Like, is that even an option in a theoretical world where policymakers would be discussing it?
I mean, legally, it's not possible. But I mean, you have, for example, right now, but you have in Germany for heroin addicts, you have the possibility to prescribe pure heroin, right? Diamorphine therapy. This is the provision of basically pure heroin or pharmaceutical quality heroin to addicts. So there are I'm not a lawyer, but there are loopholes already in the narcotics law in Germany. But at the international, yes, exactly. Switzerland, cocaine, I'm not sure. But it's in Switzerland, what you have is basically they allow for micro trafficking of crack in drug consumption rooms, something that is not legal in Germany in those federal states where we do have drug consumption rooms. But of course, I mean, the drug use as such, drug consumption is also not illegal in Germany. So if you get caught with cocaine in your blood, you have not committed a crime. The trafficking is the issue, and we have decriminalization of possession, right? It depends on the federal state where you live. In Berlin, it's quite, let's say, tolerant. In other federal states, it's not. So we have like certain legal ways of basically avoiding to punish consumers for consuming drugs. But of course, we have the prohibition of the whole drug market as such and the transactions of it. And in the current legal system and also at international level, cocaine is scheduled under the 1961 Civil Convention on Narcotic Drugs. And also coca leaf, despite several attempts to remove it from there. So it's legally challenging. So it's not something that you could easily do. And also where, for example, federal states or cities could simply try to establish another system. It's not working under federal and European and international law.
Okay. Thank you. And it's very interesting. We actually have someone here from the German Federal Ministry of the Interior, Flora Frenze, and she wants to share their current Instagram campaign from the Organized Crime Department because it closely relates to today's topic. The campaign highlights the hidden consequences of cocaine consumption, including exploitation, violence, and organized crime, with the aim of raising awareness about the broader impact of cocaine use. We'd be happy if you checked it out on Instagram, Koks erzählt, or cocaine-insights.com. So thank you very much for that. And nice to see what is happening at a federal level there as well.
It's actually worth to follow the campaign because it's quite unexpected in terms of content, and it focuses heavily on the harms, environmental harms, societal harms, the development aspects of it. So it's quite good. Recommend it.
Yes, very nice. And for the moment, I don't see any other questions, but as we still have some time, feel free to add some last questions. In the meantime, I would already ask Joella and Daniel for maybe some final input, something else they want to say, and specifically if you have any further thoughts on how to involve civil society organizations in this whole debate and the whole topic of drug markets and especially cocaine, of course. Considering that Mafianeindanke, of course, is a civil society organization, but there are many, many others who work in all kinds of topics. So maybe you also have some best practices or some examples that you would like to share. Whoever wants to go first.
Well, as I mentioned before, with the last slide I presented, civil society organizations, I believe they are a fundamental part of community-based approaches to drug and crime prevention, and building more on what already said before, because they do have the reach, they do have the trust of the local communities. They are in the places where formal institutions don't have reach. And I think it's also important that they give a voice to the people that otherwise wouldn't be heard. So, for example, if local communities or neighborhoods are concerned about, for example, public in drug use in public spaces, which is my experience with the civil society organizations. They were concerned of this happening in parks and beaches. So it gives a voice, and they keep raising awareness on these topics that they are worried about in their communities, in their surroundings. And I think it's also important to see that I think they are the ones able to connect the actors who don't naturally talk to each other or collaborate with each other. So they connect health professionals, they connect schools, they connect the families, parents, and so on. And they are the ones with this potential to building trust between them and finding these common objectives, common concerns in their community. And I believe because they are doing this advocacy work, keeping these topics relevant when even perhaps the political attention moves on to something else. They push for the things that worry them, and it gives continuity, right? So this is what I want to add regarding the work of civil society organizations. And yeah, just as a final thought, many things in health and social responses based on community coalitions, they make it happen because it's done with them, with the civil society organizations.
Thank you. That's actually, I think, also a very positive note for everyone here, because it means that there is a chance to move something even on a small level, even in your own community, your neighborhood, or wherever you are. Daniel.
Yeah, Joella already raised several points. I mean, we're speaking about drugs and cocaine here. The whole German drug policy is basically the backbone of it is civil society in terms of harm reduction services, care, drop-in centers, prevention efforts. We just heard from Joella about the big amount of crime prevention, civil society organizations in Germany. That is a very important role. But I think there are many roles civil society can play. And mafianeindanke is a very good example. You have a key function in Germany because you put something high on the agenda that is very often not visible. We're speaking about cocaine today. Cocaine has some visibility, and it's quite a lot of Netflix coverage of it, and people are interested in it, so it gets attention. But other issues like the Ndrangheta you just mentioned, after the Duisburg killings, the attention went up and then it went down, and it's very hard to have a public debate about it. And you have played a key role in terms of lobbying, advocacy to raise awareness. And the same is what the Global Initiative does, the organization I'm working for. We are putting things on the agenda that very often don't make it to the agenda, and we do that through research. And we have showed some examples of what we do, because we have, especially in Germany, our whole debate on organized crime depends heavily on public data. Nothing is wrong about official data from the government, but this is basically data that is backward looking. Because it's the data on what has happened 2 years ago in terms of organized crime and drug trafficking, how much has been seized, how many cases, how many arrests, etc. That's all fine. But that also means if we only depend on this data when we define our policy, we're basically driving our car by looking always in the rear mirror, and we are not forward looking. And I think this is a key role that civil society can play to raise awareness, of course, but also to project for policymakers and for the greater public what organized crime is happening right now and what will happen in the future. And that's what we try to do. And mafianeindanke and the Global Initiative, we are jointly pitching for an organized crime monitoring center in Germany, because we don't have anything like it. And our two organizations would love to have that, because we just depend too much on the publicly available data, and we do not really understand what's happening in terms of organized crime beyond these elements of it that don't make it to the headlines. So I think there are several roles to play, but in particular, public debate, public awareness, independent research, independent data to complement official data that is can really make a difference. Judith, you are based in Italy. In Italy, we have a different situation than here. It's way more advanced in terms of civil society, and there's a lot we can actually replicate, I think, from the Italian experience. I'll leave it here. Thank you.
Thank you so much. And yes, indeed, thank you also for the nice words about mafianeindanke. Indeed, I think what the Global Initiative and mafianeindanke have in common is that we love to bring the light into the dark, so cover topics that are unexplored or underreported, and put also difficult questions on the agenda. But of course, so does the European Union Drugs Agency. So for all of you who are interested in this topic, if you like this event, please feel free to follow the EUDA, the Global Initiative, and mafianeindanke and all the channels that you are using. And with this, I think there are no more questions. So thank you very much for being here, and see you maybe at the next event. Goodbye.
Bye-bye.
Bye. Thank you all.